Ram, and I'm the founder and CEO of Arogya World. We are a global health nonprofit that's working on chronic disease prevention, particularly in India. We promote healthy living and we promote non-communicable disease prevention through healthy living. We have large programs in India that we have done, and we've reached about 5 million people to date. And during COVID, we decided to switch to these webinars to just engage more people in the issues we care deeply about. We think very hard about so many things, and for some time now, we've been doing a series of webinars, but this obesity topic has been, front and center for us because it's the precursor to so many non-communicable diseases. And we have today somebody really great to unpack all this for us and to show us what is the link between obesity and COVID, and to unpack all the differences, the links to non-communicable diseases. Dr. Robert Kushner has a long and distinguished career as one of the most highly respected weight management experts in the world. He's a medical director of the Center for Lifestyle Medicine at Northwestern Medicine in Chicago, and professor of medicine and medical education at Northwestern University Feinberg School of Medicine. He's the past president of the Obesity Society and a founder of the American Board of Obesity Medicine that certifies physicians in the care of patients with obesity. Dr. Kushner is a passionate clinician, educator, researcher, and advocate in helping to improve the lives of those affected by overweight and obesity. A noted national and international speaker, Dr. Kushner teaches healthcare professionals about both the science and the art of helping individuals lose weight and keep it off. So we're really fortunate, Dr. Kushner, to have you address the Arogya community. So without further ado, please give us some opening remarks, and then we'll get into Q&A. Dr. Kushner.
Wonderful. So I thank you for joining me. You've disabled my ability to share the screen. So if whoever has that, I'd like to share it. Is that possible? Whoever's in charge of this? Because I can't do that. If that's the case, I may just have you show the slides for me because I can't share my screen.
Lauren, can you help?
Yep, working on that right now, sorry.
Okay, wonderful. Sorry about that all. Nalini, I want to thank you before we get the slides going. I want to thank you so much for inviting me to present to your whole community and to connect with you once again. Since you left Chicago, virtual remote communication has allowed us to connect even though you're no longer in the Chicago area.
No, but I have a home in Chicago, and Chicago is always home.
Right. All right, here we go. Thank you so much. So I am allowed to do this now. Thanks for allowing me. Wonderful. Can you see that, Nalini?
Yeah, we can see this well.
Wonderful. So this is the title of the talk based on an update on obesity and COVID-19. For those of you who have not seen it yet, this is the depiction of what the COVID virus looks like on the screen. I've been doing weight management for nearly 40 years now, and obesity has always been a problem of we call chronic illness. It's a harbinger to developing diabetes, high blood pressure, sleep apnea, arthritis, and so on. In my career, this is the very first time that obesity has come front and center. A light has been shown on obesity to be linked to an acute illness. Very first time that we've actually seen this. And this kind of acuteness of being overweight and the risk of being overweight has been brought to light in large part, and I'm showing a heading here of Boris Johnson, who, as all of you know, developed COVID-19, was hospitalized, I believe he was in the ICU as well, survived, and he now has this passion of getting underweight and bringing the whole UK population along. So it's a very important topic as highlighted by this headline and the acuteness of obesity. What I would like to do during my short presentation, we'll have plenty of time for Q&A with Nalini and I after this, is to give you our current understanding of why obesity is linked to COVID-19. Some of it will be medical, and I will try to explain it to the best of my ability, but my hope is by the end of this presentation, you will be enlightened, more informed about the link between obesity and COVID-19, and ultimately take better care of yourself as well. So what do we know about the risk factors for COVID-19? Well, this is the latest list of risk factors from the CDC here in the United States, and it's been updated a few times. This is the very last one. The risk factors are someone of any advancing age. It used to be individuals 65 and older. They've now changed this to anyone with advancing age who has cancer, chronic kidney disease, COPD, immunocompromised state. I bolded obesity. It's not bolded on their website. I bolded it so that you would see how I am highlighting one of the risk factors. And the others are heart disease, sickle cell disease, and type 2 diabetes. So what is it that we know about COVID-19 when it relates specifically to obesity? Well, I think the first thing that most people probably think about is, well, if you're overweight or have obesity, you're more likely to have other chronic diseases that were already listed on that on the CDC website. Therefore, it's kind of a conduit. If you're overweight, you're more likely to have diabetes. Therefore, you're at risk of having COVID-19. And that in part is true. We do know that individuals with obesity have a greater risk of developing diabetes, hypertension, heart disease, and sleep apnea, which is something I'll talk about a little bit later. One of the earliest studies that was published in the journal JAMA from New York looked at 5,700 individuals who were hospitalized with COVID-19, and a little over 40% had obesity, and that was second only to those who had hypertension and diabetes. Now, let me put this in context. In the United States, about 42% of individuals have obesity. So that kind of links to the prevalent United States. Hypertension prevalence is about 30% in the United States, diabetes about 10%. So you can see it's really heightened in those that have hypertension and diabetes, and it kind of matches what's going on with obesity in the United States. We also have information from the 2009 influenza H1N1 pandemic. So there's a lot published on viral diseases and obesity prior to the COVID pandemic. What we know from the 2009 pandemic, the H1N1 flu, was that obesity was seen as an independent risk factor for complications and death from that virus. And we also know that obesity significantly increased the risk of dying from it and having critical complications almost twofold higher. What I showed on this slide, and is a cartoon, of course, a figure, is all the medical problems that someone who has obesity is at risk of developing. And I highlighted in yellow the particular medical problems that may put someone with obesity at risk of having complications of COVID-19. Now, this doesn't put them at risk of acquiring or being exposed to COVID-19. This puts them at risk of having complications from COVID-19. Most of it's cardiovascular. It's also pulmonary, but also things like cancer, diabetes. People with obesity also have an increased risk of developing blood clots, even without COVID-19. And now we know blood clots is a potential problem with that. Now, here's something that's a little bit more medical, but it turns out it is fundamentally important to understand what we are now beginning to think, why obesity by itself, independent of all these other medical problems, may put someone at risk of having complications. And it has to do with cytokines. And some of you may have heard the term cytokine storm or cytokines by themselves. So obesity by itself, without these other medical problems, is a state of we call metabolic dysfunction and low-grade inflammation. And what that means is that as you gain weight, particularly in the upper part of the body, this upper segment fat distribution, apple shape, if you will, there's increased levels of these cytokines, which are proteins or molecules produced by inflammatory cells and circulate at very high levels. Yes. By this chronic state of low inflammation. So all these cells produce these high levels of cytokines, which are inflammatory. And we now know that individuals who have complications of of COVID-19 end up on a ventilator in the intensive care unit and death, where they have respiratory distress syndrome. Their lungs are filled with fluid. It's not the virus that is filling up their lungs. It's the cytokines that then release all this mucus and inflammation that cause the lung damage. So in other words, obesity by itself has a low level of the cytokine regulation or release. And when the virus infects you, it has this storming effect of the cytokines that are already there, which cause an immune damage and inflammation throughout the whole body. So it's as if obesity is this predisposition, almost waiting to get infected, and then these cytokines go into hyperdrive, which then causes this lung inflammation. So for these reasons, we think obesity by itself, independent of all the other medical problems, puts someone at risk of having complications. Now, this is another figure, and there's a lot of medicalese on here, and it's not important that you know this, but I picked this diagram because it kind of highlights one additional factor I want you to be aware of, and it's right in the middle. It says SARS-VO2 reservoir as obesity. This is another important concept. It turns out that the receptor or the target cell in which the COVID-19 attaches and gets in the body, fat cells are very high in this receptor. So we are thinking now that the virus has a reservoir of living longer within the fat cell there, or the whole fat depot, therefore can continue to infect that individual on a longer term basis to someone who's not overweight. So it's the cascade of ongoing viral spreading within the body that causes this multiple organ dysfunction that leads eventually to complications in the lung, the heart, the kidney, and everything on the left, which are developing more hypertension, diabetes, and so forth. So it's this immune dysfunction and increased hypercoagulability, which causes blood clots and ongoing inflammation that really leads in large part to the problems that individuals have. Now, in addition to that, it's like a double whammy. In addition to this, individuals who then get into the intensive care unit who have obesity are much more difficult to manage. So they're already starting from a place of having more complications because of their weight. And what I've listed on the left here are all the problems in managing individuals who get into the hospital. Example, it's very difficult to ventilate someone who has severe obesity when they're on a ventilator because of the increased abdominal girth, the diaphragms are high, and they may have underlying pulmonary problems. They may also have what's called sleep apnea, or OSA, obstructive sleep apnea, obesity hypoventilation syndrome. These are individuals who have to wear a CPAP mask when you see them on a plane, or you may have family members who have sleep apnea. That makes it more complicated. It's also difficult to manage their airway, to put a mask on them or to put IV lines in them because of the increased fat. You've also probably heard a lot about what's called proning. Proning is what they do in someone with COVID-19 in the hospital in the ICU, where they found that if they put someone on their stomach, they can aerate the lungs, which are in the back of the body, more successfully. Well, if you have someone with a large abdominal girth, and you've seen individuals like that, of course, it's very hard to put them on their stomach because of the large abdominal girth and then go ahead and ventilate them. Other problems are with imaging, putting them in a CAT scan or an X-ray machine because of their weight. And lastly, transportation issues and positioning them is very difficult. So because of their size and their underlying physiology of the lung, it's very difficult to manage these individuals. So what do we know now about studies? That's kind of the background information of why they're more likely to get sick and difficult to manage. Well, what do we know from the studies that are being published on COVID-19 that are now initially coming out of China and now coming out mostly of Europe and the United States? What we know beyond any doubt is that individuals with obesity, and that is a body mass index over 30, it used to be over 40, which was severe obesity. We now know that anyone with obesity, the BMI over 30, also with these other comorbid conditions like diabetes, hypertension, have an increased risk of being admitted to the hospital from the emergency room. Once they're in the hospital, they're more likely to be admitted to the intensive care unit. When they're in an intensive care unit, they're more likely to require mechanical ventilatory assistance, which means putting on a ventilator. And once on a ventilator, increased risk of death. So it escalates at each of the steps that are likely to occur to develop diabetes. And these risks are 2 to 4 times higher as you go along each of these pathways. We also know there is racial and ethnic differences between who is being hospitalized. This comes from the United States. So even among those with obesity, we know there's a higher risk among American Native population, among African Americans and Blacks, Latinos, and so forth. And that is a very complex, I think Nalini and I are going to talk about this a little bit more about what's going on and why that is actually occurring between association with wealth and essential workers and crowded environments. But I did want to show you just only one study that came out recently, which I think is fascinating. And they really tried to get to this understanding on what is it about race and socioeconomic status that is linked to increased hospitalizations and risk. And it comes from actually the UK. Just as a quick background, the UK Biobank is a large, prospective, deeply phenotype meaning understanding the behaviors and thought patterns and patterns of life versus genotype, which is your genes, in a population. And they had about 500,000 database of people, 500,000 people with a database, ages 37 to 73 that were studied in the past. Of those 500,000 people, 340 had confirmed COVID-19 infection complicated by pneumonia. And when they went back and looked at these database on what was it about those individuals that potentially put them at higher risk of having a complication, what they found were they had a higher BMI, which means they had obesity, higher, and relative risk, by the way, is the more likelihood of having it. So more likely to have obesity, more likely to be smokers. They walked at a slower pace, which is probably a marker of low fitness or being overweight, and they had high blood pressure because they used medications. Now and so those are the modifiable factors. The non-modifiable factors, they were older, they were more, not but male sex, Black ethnicity, socioeconomic deprivation, and longstanding illness. So we're trying to understand, and this study helps a little bit about what is it about those individuals. And I'm sure we'll talk about that a little bit later. And let me end this part of the talk, and I just have just a few other slides. I tried to summarize putting it all together on this slide. So it turns out that those perhaps of lower socioeconomic status, poor diet, reduced activity, and some race and ethnicity because of the social construct of race and ethnicity, and obesity, they end up with lower compromised lung function and other chronic diseases. We talked about that. On the other side is this immune problem. They may have increased viral shedding even within their own body and outside their own body, which puts this combination together of cardiorespiratory problems, lower fitness, hyperactivity of the immune system, increased viral exposure, and that then leads to complications. I want to end, though, with my last 2 slides about what we can do about remaining healthy during this period of time. And this comes from the CDC in the United States, and this is probably worldwide at this point, is wash our hands, stay 6 feet apart, wear a mask, don't touch your eyes and nose and mouth and so forth, avoid crowded places, and of course, don't go to work if you're sick. Now, here's my addition to what the CDC should be adding, and this is what I tell all my patients, is how do you maintain self-care? And there's 6 recommendations I have. One is to establish a daily schedule and incorporate health behaviors if you're not going into work. So maintain those health behaviors. Set meal and snack times. Plan in advance and choose nutritious foods. Keep highly processed and tempting foods out of the house. Again, we're spending more time in the house now we have to have a safe haven when it comes to our house. Schedule daily physical activity in any way that you can. Get adequate sleep. You may even need to set an alarm for wake up time and bedtime if you find yourself falling out of any schedule. The last two, extremely important. De-stress. Unplug yourself from the 24/7 news through a variety of things you can do, relaxation tapes, engage in projects, listen to music, and so forth. And lastly, which is to strengthen self-empowerment and improve health and well-being, so that you could improve your immune response, that power to avoid having complications if you actually get COVID-19. So Nalini, I hope that gave kind of a background to our discussion, and I'm going to stop sharing my slides now and turn that back to you.
Great, great. Dr. Kushner, thank you so much for so clearly establishing the link between obesity and COVID. This is really scary for so many of us, with a BMI of 30, that's a lot of people. I think 40% of adults in the United States are at that level. So this is huge, that so many of us are at high risk for COVID. And then if we get the infection, it's going to be more severe likely. And then some, even every step in the hospital is, double or 4 times the risk. So this has been illuminating. Thank you very, very much for so clearly explaining all this. What would be the extent of the crisis then in the United States if 42% of American adults with BMI of 30 or higher? This is then definitely a huge issue. Is it becoming more of an issue now in COVID times when so many Americans people from around the world too, but are spending so much time at home? Is obesity worse?
Yeah, so I want to go back and clarify the BMI, because I said that and you amplified it, but I want to be very clear that using body mass index to identify the disease of obesity is a very blunt instrument, because you can have a BMI of over 30, but not have obesity. In other words, you could be very muscular. Right, a lot of athletes, a lot of people who are very athletic have a BMI over 30. So it's a blunt definition to identify those at risk. So what we're really talking about are individuals who have excess body fat, so not excess muscular tissue. So that's just a clear definition. But from a CDC point of view, it's an easy way to identify targets. Why do we have such high numbers in the United States? Many factors. Certainly, we have probably one of the largest prevalence of obesity among diverse populations. There are some populations with higher prevalence of obesity, but it's more homogeneous populations like South Asian islands and different kind of genetic closed communities. In the United States, we have the highest prevalence. So that may be part of it. I think we also have, of course, issues of not masking and getting together and so forth. But it's a terrible problem. The obesity has been an epidemic in the United States and now crossing the world for decades. As I said before, this is the first time that I am aware of in my 40-year career that a light is being shone on obesity or shined on obesity at such a high profile. And it's because of the acuteness of what obesity is causing among COVID-19 complications.
Mm-hmm, mm-hmm. So we've been reading a little bit about COVID vaccines, and the whole world looks like it's the hope of the world. There'll be a vaccine soon. And then if the recent articles that, hey, people with obesity may not have it may not be so effective in people with obesity. So I wanted to get your thoughts on obesity and the effectiveness of a potential COVID vaccine.
Yeah, it's a great question. We don't have that information right now, but what we do have is information from influenza vaccinations, which are not necessarily, they're not COVID viruses, but if we can extrapolate from other virus immunizations or vaccinations, it gives us pause to think about what may happen with COVID. Well, we know from H1N1 influenza, we know that individuals with obesity have prolonged viral shedding, which is a concern. And we think of that because we think the adipose tissue or the fat tissue is a reservoir for virus, so they may actually shed longer. We also know from the influenza vaccination that the immunization effect of the vaccine is not as powerful in individuals with obesity, which may mean they may need a booster vaccine or something more. Now, currently, the only specific recommendations for differences in vaccines are by age. So for example, if you're 65 or more, you get a higher power virus vaccine, the influenza vaccine every year. So if you're over 65, they send you for a higher dose of the vaccine. We don't currently do that by what is your weight and you get a higher vaccine. But we need to know this much clearer, because if it's true that certain individuals with obesity require a second booster or a third booster or a higher dose of vaccine, we need to know that and potentially identify individuals that may need a difference in vaccination. But we don't know that just yet for the coronavirus.
So are people with obesity being actively recruited in these clinical trials that are being planned?
I don't know that, and that's an excellent, follow-through question. We do know that the trials are taking place in individuals in states and parts, at least the United States, and Europe, and maybe the same in other parts of the world, where the virus is active. So the prevalence of it is very high, so that you're having a lot of exposure. It's the only way we know whether a vaccine works or not. I know they're selectively recruiting individuals at different socioeconomic groups, racial and ethnic backgrounds, because we have to demonstrate that works. I am guessing, since roughly 3 out of 4 Americans are overweight or have obesity, I am guessing they're going to be a very good representation of that population as well, just because it's so common in the United States. But I don't think they're over-sampling that group.
Right. Okay, well, one more thing to watch about. So in general, Dr. Kushner, why is weight loss so hard for so many? Why is it so difficult to lose weight? And has it become worse during COVID times? What are your patients telling you? What are you telling your patients?
That's a great question. It's a kind of a two-part question. The first is why it's so hard in general. And the reason is because obesity is a multifactorial problem. It is not a willful misconduct. It's not entirely under, people don't want to lose weight and they're sloth and gluttony and, eat less, move more. That's just too simple, and it's not the story. There's a big biological determinant of what you weigh. It's called, you have a predisposition to put weight on. And if you want to know if you have a predisposition, look at your parents, look at your siblings, look at your family, because there's a large genetic contribution to whether you're going to put weight on or not, including body shape. Once you have this predisposition, it doesn't take a lot to manifest being overweight based on your social situation, your lifestyle, your physical activity, and your diet. So there's all these factors come to bear. Life events is another one that causes one to continue to actually gain weight. So that's one thing. And it takes multiple factors in order to control your body weight. As far as what you can do about it, take control, pay attention to your diet, physical activity, work with other professionals. One thing I didn't show on my slides, I'm not sure why, is that just for those who are interested in a book, I recently wrote a book called 6 Factors to Fit, which you can get from Amazon. You could also get it in India by going to a international distributor. So that is available. And just to mention my own website, drrobertkushner.com, that you could actually get to the website and access the book. I want to mention that. But what the second part of your question is, how has the COVID-19 pandemic affected individuals? And I would say it's bimodal. It's two different ways. Clearly, this has been an extremely stressful time for all of us. And if you had anxiety or stress before the COVID-19 pandemic, it's heightened. And you're probably even more stressed and more anxious. And that has led to a lot of mindless eating, loss of control, early on, a sense of loneliness, depression, social isolation. A lot of that can be detrimental to your weight because your behaviors succumb to that. However, I'll also tell you that I said it's bimodal. There's a whole nother group of individuals that I have been talking to because I've been doing what's called telehealth since March, where I've been doing, video and telephone visits with individuals for the past 5 months. I have a whole nother group of individuals who have done incredibly well. Why? They're not frequenting fast food anymore. If there isn't food in the marketplace, they're not spending 2 to 3 hours commuting in their car. They have more time for self-care, and they're starting to prepare their own foods for the first time and not relying on fast food and all that stuff. So they have become empowered in order to take better care of themselves. And the COVID-19 has really brought to light something I've been thinking about a lot recently, is the importance of adaptation and resilience. Because if you are not a resilient person, right, you're able to fight back and problem solve. The COVID-19 has been a huge threat to yourself and your well-being and your quality of life. But if you have that empowerment and the resilience to adapt, you actually have done better. So on my telehealth visits, I really talk a lot about self-empowerment, checking with your values, being resilient. If you haven't prepared foods before, learn how to do that. Set up a schedule for yourself. Take better care of yourself. Go for walks and so forth. So it's really, the pandemic has affected people in various ways. I'm trying to nudge people more and more to the self-care and resilience during a very difficult time.
Yeah. So I'll go to a question that's come in the chat box. You can look at it as well. And this is, she says, I read an article that stated smaller bodied people systematically received earlier antiviral treatment than larger bodied people. Controlling for this difference eliminates the impact of obesity in H1N1 fatality. Obesity kills, but the critical mediator is not biology, it's bias. So can you comment on that in respect to COVID-19 and obesity?
Well, in the early trials for COVID, which are called phase 1, phase 2, that's basically, is the virus safe and do you produce antibodies? By tradition, they recruit individuals who are healthy and younger. So they avoid people with severe obesity because that's the nature of what the phase 1, 2 trials are. When you then go out and do what's called phase 3 trials, that's what we're doing now. Does the vaccine work? They're reaching 30,000 individuals, 10 to 30,000 individuals in the phase 3 trials, of which there is no limitation of what they're actually assessing. So they will know by hopefully the end of this year whether the vaccine works and who does it work in. There is clearly bias among treating individuals with obesity, and that comes from social norms and this whole idea of seeing someone overweight and the bias that we all, and stigmatization that is expressed. So I think we have to be very, very clear as we go forward with the testing of the vaccine and use of the vaccine that we're aware of this bias and we actually don't let that interfere with our decision making.
Yeah, it's vaccine, it's also treatment and care, you did this to yourself in some ways.
Correct.
And, it's not always, as you said. So, again, something very, we've got to think deeply about. I wanted to get to this question of race and obesity and health inequities that you brought up slightly, but I wanted to get your views on that. COVID has unearthed so many cracks and fissures and has shown us so many health inequities. And now we have obesity, and those same race things are there with obesity as well. So I just wanted you to talk more about that.
We have this confluence of all these racial concerns, at least in the United States, with George Floyd and Black Lives Matter and so on, which has spread to other parts of the world as well. But it really is, as you said, put cracks in all of this. And it's really highlighted these racial disparities, not only in social justice, but now inequalities in healthcare and so on. And I want to emphasize that race and ethnicity is a social construct. It's not purely race at all. It really opens up what is actually going on here. And we know from the literature that the strongest predictor of health is wealth. And we know that. So the wealthier you are, which means the more access of care you have, the built environment around you, the affordability for having adequate leisure time activities, food, access to healthcare, and so on, is related to your health. And we also know that those of lower socioeconomic status, at least during COVID-19, are the frontline workers, right? Working in grocery stores and other shops that are being exposed to COVID-19. And if they already starting out potentially less healthy because of all of the inequalities I just mentioned, they're at increased risk of complications. So it's very, very complex. I am encouraged that this pandemic is shining a light on these disparities. I could tell you in my own medical school at Northwestern University, Feinberg School of Medicine, we have made fundamental differences now in our education to really be much more cognizant and aware of these disparities, at least in education, and of course then next to transition that to clinical care and care for these individuals. So a lot to be learned from what we are actually experiencing right now.
The hope is that we'll all learn, and everybody will take this a bit more seriously and really tackle these root causes, because we can't afford for the healthcare system to fall apart.
Correct.
in the way it has. As a consumer, Dr. Kushner, we hear so much about low carb, low fat, keto diets and paleo diets and intermittent fasting. And honestly, we are confused. As a consumer, I'm confused. I don't know which way to go. Should I go for a low carb or high protein or low
Right.
diet? What should we do? What is your advice?
All of those diets, unfortunately, are distracting from what people need to really be thinking about. And that is, which is emphasized in a lot of guidelines from around the world, and that's called dietary patterns, not nutrients. So when it comes to dietary, there are many dietary patterns that can be very healthy for healthy weight, prevention of diabetes, hypertension, longevity, and so on. And that's the dietary patterns of ample amounts of fruits and vegetables, a pattern where you're eating meals and or snacks throughout the day without skipping those types of things, calories that are appropriate for your weight and not excessive of that. If you're going to have carbohydrates, make sure they're complex, high fiber carbohydrates, reduction of ultra processed foods, which are packaged foods that's processed so much that you can't stop eating them because they're processed for that mouthfeel. Avoiding saturated fat and too much meat fat, and avoiding sugar and so forth. That's what we want to be thinking about. Now, having said that, if someone is interested in a Mediterranean type diet, in reducing simple carbohydrates, watching the salt in their diet, that is perfectly fine. I don't really talk a lot with patients about keto or paleo. They're very finite, specific diets that are really meant for an acute treatment and used for short term in general. Very few people are able to follow a ketogenic diet for the rest of their life, or intermittent fasting, which is either eating low calories on one day, higher on the next day, or time restricted eating, which is eating between, let's say, 10 a.m. and 4 p.m. or something like that. It's very hard to do that because of social interaction. So someone who's trained in lifestyle medicine, frankly, don't talk a lot about those diets. I really talk about meal and food patterns that you could follow long-term and are really good for your health.
Right, right, right. It would interest you and perhaps everyone on the call as well that we have in India created a picture of a thali, of the Indian plate, with containers showing exact quantities of cooked food that someone should eat at every meal. And we copied the approach of the US Department of Agriculture in the my plate approach. Good ideas should get copied. And so we created it for India, and we are promoting it now to very aggressively using social media, and going to working people in companies, promoting that picture, so that women can get empowered to go cook like that. Again, as you said, the traditional Indian foods are probably really good. We just don't stick to the traditional food, and we try to do everything else now. So in India, that's what we're promoting a lot. My thali. I'll send you a link just so you can have a look at that. What can be done? Do people have questions? Please don't feel shy. Dr. Kushner is a real expert. Please ask any questions you want, and he's very happy to, take anything. So please throw questions at him, he'll take them. But if you don't have any, I have more. So I was just curious, in a country like the United States, which has so much of the population, 100 million people on the obese, scale, how do you tackle obesity in a country like this? What can be done? I mean, even from a pure public health perspective, what can be done and what is being done to tackle obesity?
Yeah, it's incredibly challenging. We do have a epidemic of obesity. Again, if you think about over 40% of the US population has obesity, and almost 3 out of 4 have overweight and obesity. When you combine them, it is truly the most common medical problem. It is a public health issue. And I think that is the biggest challenge, because we have not had a public health broad-based initiative to inform people and give them strategies and the support systems needed to control their body weight from a public health point of view. Public health approach would be social marketing, so losing weight in a very positive way that you may see on billboards or through different media. We do have food labeling in the United States, which is everything is labeled for calories, but the problem is not everyone knows how to interpret what that means. We talk a lot about physical activity and leisure time activity and recreation, but it's not really emphasized as much. So that's problematic. The other significant problem is this social bias that you brought up earlier. That is a real problem. People still have this feeling that someone who's overweight brings it upon themselves, and they're lazy and they don't have enough self-worth and empowerment to take care of themselves. And that's farther from the truth. So we have to get over this bias. So from a public health point of view, it's extremely challenging. That's why my first slide with Boris Johnson was, it's the first time I've really seen a public figure in, I hope, a positive way saying, hey, Britons, UK, we have got to take better care of ourselves, and we've got to get ourselves in better shape. We don't see that in the United States. Medically, there's a lot we can do. We have physicians like myself, we have registered dietitians, we have commercial programs, we have medication, bariatric surgery. Now we're getting into the medical management, but we have a lot we can do from a medical point of view. So I encourage everyone who's struggling with their weight to seek medical attention and get that kind of help. But from a population point of view, it's very, very difficult.
We're having a couple other questions that have come in. So are there any magic diet pills, and like oxygen from France? And what about procedures such as gastric balloons? Do you believe?
So we have some very good evidence-based approaches to treat obesity. They're not magic pills. I know it's kind of a tongue-in-cheek question. We don't have magic pills, but we do have medications that have been tested and are evidence-based can be used safely and are effective in losing weight and reducing comorbid or medical problems, available globally. So there are medications, and that's where a physician would go ahead and, or a advanced practice practitioner would go ahead and prescribe them. For patients who are suffering from severe obesity, we do get evidence-based effective surgical treatments, such as a gastric bypass or gastric sleeve. Those are what they're called. The balloons are temporary. They really don't work all that well. They have to be taken out at 6 months, but there are surgical interventions. So for someone, bottom line, for someone who is suffering from the disease of obesity with all the medical problems and quality of life issues, I would encourage you to seek medical attention, because we do have safe and effective treatments can be helpful for you.
Okay, awesome. A couple more questions have come in, and this is for those of us who have the appropriate wealth and time, we still don't choose to follow a healthy lifestyle. What psychological issues are at play here? We know it's right, but we don't do it.
Yeah, well, I think it's life events, and I talk a lot about that in my book, 6 Factors to Fit. This whole idea of understanding yourself and how you think and how you behave, and I think it's your interpretation of life events and how you look at issues around you that determine how well you're going to take care of yourself. For most people, they have the knowledge to eat healthy and being physically active, right? It makes sense to do that. But the daily priorities and events that go on distract us from doing that, whether it's your job, your children, family, other economic downturns, COVID pandemic, stay-at-home orders and so forth. It just makes it difficult to keep self-care on the front burner. Mm-hmm. So that's really, yes, you have a choice, but you have to be kind of reminded that among all the life events and stressors that are going on, taking care of myself has to remain a priority. And getting the social support around you and the prompts and strategies to do it is the way to actually, go forward and be successful.
Yeah. Yep. Make time for yourself. Take care of yourself. Women, we are very bad at that. Men are too, but this is a life lesson, Dr. Kushner. There's been a couple more positive comments already on in the chat, but there's a question on children. And this is something I've been thinking about as well. That hey, kids are staying home now. And young adults are staying home now, and they're not going out, and they're not doing the things they were, it's not like they went out and played so much, but even the physical activity that they had access to, they are not doing. So has there been some, more concern about children getting overweight, and, what can be done again about that?
Yeah, at least in the United States. I don't know as much about the rest of the world, but at least in the United States, childhood and adolescent obesity is becoming a serious problem. And we now know that children and adolescents who develop obesity develop the adult complications earlier, like diabetes, sleep apnea, functional problems with joints, quality of life issues. They also, of course, unfortunately, are susceptible to bullying and teasing that you don't see as much in an adult. In adult, it's more quiet bias, but in children, it's overt teasing and bullying. So it's a terrible, terrible problem. And there is more and more attention being played to helping children and those that are teenage years to get control of their weight. As of now, we don't have a lot of, unfortunately, successful programs. What we're trying to do is to halt the weight gain as the child grows, to let their height catch up. But it's very, very challenging to do that. Probably the most important thing is the family unit, family structure, family role modeling, because that's where they get their meals from, where they get their values from, and spend a lot of their time outside, of course, of school and their friends. So setting up a safe haven home environment with healthy foods, doing family physical activity, not stressing weight loss, but stressing health, is probably the most important thing that we can do.
Right. Count, thank you very much for putting the link to my tally here. Count has come up with a cricket-based app for India, corporates in India. So we're in conversations with him to see what we can do together. I completely agree with you, Dr. Kushner, and it seems to me that if we eat right and exercise, we not only will have a healthy lifestyle, we'll boost immunity, and we'll fight obesity and prevent non-communicable diseases all at the same time. So for me, what this COVID times and all these conversations are bringing home is that what we are trying to do at Arogya World, which is push healthy eating and healthy living and exercise, is actually really great, and it is great on so many fronts. And from my side, your talk today has been brilliant. I would love to see if we can work with somebody to do small snippets of this and share it on social media, because what you've given us today is a wealth of information, really and truly. But do you have any parting thoughts for our audience? Do you have any, any words of advice?
Well, one thing I do want to, today doesn't have to be the last time you interact with me. That's one thing. I would encourage all of you to go to my website, which is drrobertkushner.com, one word, drrobertkushner.com, where you can get blogs and newsletters. You can log on and take a quiz to find out about yourself and regarding your own health, as well as find out more about this book, 6 Factors of Fit. So it doesn't have to be a parting shot. You can interact with me further. The other is, just to summarize what you just said, is the self-care. Is really, don't let your self-care fall to the wayside during this very troubling time. The more you can take care of yourself, become empowered, pay attention to your diet, physical activity, your sleep, and stress, you will empower your immune system so that if you acquire COVID-19, you will be in a better shape not to get complications, which is probably the most important thing that we want to attain.
Right. No, this is great. So just as a follow-up to everyone, thank you for coming to our webinar. I wish more people could come. We'll find a way to get this to more people. But we will summarize the learnings from today in an article that we'll find a way to publish. And we also, are there any other questions that have come in the chat box that I haven't answered? Here it is. Yes, we still have a couple more minutes, so we'll get to it. I'm a vegetarian. How can I meet the dietary suggestions you mentioned and ensure I get protein? And she said, thank you for this amazing conversation.
Yeah, well, of course, there's many vegetarian protein sources, from tofu to beans, legumes, seitan, and so forth. I think the best thing really to do is to go to the internet and just type in vegetarian proteins, and you'll get a whole list of them. But to summarize that, if you're going to go vegan, you have to be very knowledgeable about where you're getting the sources of your nutrients. Between between protein, which was just brought up, but also vitamin B12, getting adequate iron stores, iron intake, and so forth, calcium. So you have to be very knowledgeable. You can't go in this without being informed. If it's more vegetarian type foods and you're allowing things like eggs or fish or dairy, it's not as difficult. But if you're a pure vegan, I would encourage you to go ahead and search vegan proteins on the internet, and you'll find a whole list of adequate sources.
Mm-hmm. Okay. And there's one more question. Does malnourishment, in addition to obesity, lead to COVID complications?
Yeah, that's a great question. And of course, my talk was on obesity, which is excess nutrition, or at least excess calories, although you can be malnourished and have obesity. They're not incompatible, right? You could develop obesity by eating just junk food, and yet you could be malnourished, right? So that's probably clear. We don't actually have a lot of published data that I am aware of on the effects of malnutrition and the acquisition and complications of COVID-19. I would guess it's going to be very high, complications from the virus. And I think we're going to be looking for those types of publications in areas of the world that are more impoverished and have the COVID-19 pandemic within their population. I just haven't seen those publications, but I could guess, I could hypothesize it's going to be very high, just like we see with obesity.
Right, right, right. So we're getting a lot of positive accolades, Dr. Kushner, as I'm sure every one of your talks does. And this is not the first time you've interacted. You've also given a talk to our Arogya Chicago community at my home a few years ago. And you're right, we hope this is not the last time we interact. We have learned so much from you. And as I said, we'll try and digest this into bite-sized pieces for people, because each one of those talks that you had is something that everyone should reflect on. And I'd like to find a way to make that happen. I'll talk to my colleagues. And another question on underweight individuals with BMI less than 18.5, are they at high risk for COVID?
Yes. So we don't, again, I don't think we have that data. The public, so I'm basing it on publications that come out. I mean, I can hypothesize, again, the lower the weight, the more malnourished, the greater the risk, because you don't have the reserve needed to deal with and cope with a complication. But most of the publications that are coming out, at least of the US and Europe, even though those coming out of China, have really focused more on those that are overweight with obesity. But again, I would guess the underweight population would be equal risk. So if you had a risk curve, it goes up with obesity, and then it probably goes up again when you are underweight. I would guess that's what the curve would look like regarding complications.
Yeah. All right, great. Again, thank you very much for your time and your insights, and for being so clear, Dr. Kushner. You confronted the issue, you explained it, and you have really brought it to life for us. So thank you very much. And we'll take this forward and promote it, and we'll try our best to get these messages out to everyone.
All right. Well, thank you.
I do want to say we have 3 other events I want to highlight for you. The next webinar is on August 28th. It's on women and COVID, and my board colleague Gloria Barone is curating that webinar. It's going to look at working women and try to see the impact of COVID on the fabric of society, on how women and their working lives and their families and their kids and their concerns about their grandkids and all this in different generations. We have really an incredible panel, so please join that. I'm very excited about that one too. And there's another one coming up September 25th, where a San Francisco restaurant, August 1-5, and the chef, so Hetal Shah and her chef, Manish Tyagi, are going to talk about Indian spices and also about and demonstrate a healthy recipe. So we try to balance, academic talks with some practical suggestions as well. This has been both, so this has been an amazing talk. Thank you, Dr. Kushner. But please do come to our future webinars. And then we also, our gala, a national virtual gala, is on December 5th. So lots more to come from Arogya for the rest of this year. So thank you again for coming today. Thank you, Dr. Kushner.
Thank you. Bye.
Bye-bye.